County.
The UDA presidential candidate William Ruto has pledged to end what he termed as a monopoly by the Medical Supplies Authority KEMSA to facilitate access to affordable medical supplies to all health institutions, blaming it for the shortages witnessed in many hospitals. Ruto spoke during a meeting with the leadership of various unions representing health workers. The officials called for the revisiting of talks on the formation of the Health Service Commission to solve welfare issues that have hindered their operations and occasioned strikes. Let's get more details now from Chemutai Goin.
As Kenya Kwanza Alliance prepares to unveil its manifesto on the 30th of June this year, its leadership led by flag bearer and Deputy President William Ruto held a stakeholders meeting with players in the health sector to identify the gaps and the possible solutions.
We are heading in the right direction.
The DP noting that inadequate access to health has hindered the productivity of many Kenyans.
As you've heard, 30% of our population are one sickness away from poverty.
One of the Kenya Kwanza's priority agenda if elected is to review the operations of various government agencies including KEMSA, the National Hospital Insurance Fund NHIF and the National Social Security Fund NSSF.
A lot of money has been lost because NHIF, for instance, or NSSF, they would make real estate their core business. They would go on a buying spree, buying land, buying into areas that they do not need to buy into. And then when it was now time to call on the cash that is required to provide medical services or to even be able to pay the people who have contributed to NSSF and cannot get away with it, the money was not there.
NHIF is still a very good vehicle, but it has to be managed properly. NHIF needs to be responsive to the needs of its members, because people sometimes, NHIF sometimes they talk like they forget that they're a members fund. So you forget whose interest they're looking out for. It has to be there responsive to the members' needs, and that's the only way the members will stick with them.
According to the DP, the Medical Supplies Authority KEMSA needed an overhaul to first end the monopoly it enjoys in supplying government facilities with medical supplies to ensure the shortage often witnessed comes to a stop.
We have a facility that don't have drugs that are required at the right time, but they have drugs that stay in the stores until they expire. We just simply must sort it out. And you go to any health facility, you go to any county, they will tell you they have very serious challenges with KEMSA.
Other priority areas for the administration is to empower the lower cadre health facilities, including dispensaries and health centres, ensure they have staff and medication so that Kenyans access adequate primary health care, which will also minimize congestion in the higher level facilities.
We must figure out how we are going to start at the bottom, how the health centre, how the dispensary, how the community health worker is going to be empowered sufficiently to be able to deal with the challenge right at the root. We must take health to the bottom of the pyramid.
In any case, a treatment for malaria at a referral hospital is costly than a lower level where probably it will be 0 rated.
Ruto saying within the first 100 days, the Kenya Kwanza team will ensure digitization of medical records to make patient data portable and easily accessible, while also facilitating telemedicine and commodity supply.
We have got a system where we are duplicating the services from Nakuru to Nairobi between one hospital and another. So every time we're duplicating tests, as opposed to going into the system and saying, what tests have you had done?
The health workers present imploring the DP to look at their welfare concerns, with proposals for the creation of a Health Service Commission floated to streamline operations in the health sector.
If we can get our salaries on time, statutory deductions can be paid on time, and there's a system where health workers can work across the country seamlessly.
They devolved the wrong thing. They devolved the health workers.
you will hear that all of us asking for what is called a health service commission. A health service commission is devolution.
The Kenya Kwanza team later hosted youth under the Youth Economic Forum to streamline proposals for the crucial voting bloc. Chemutai Goin, Citizen TV, Nairobi.